he video hian in heart attack chungchang kan react don ani heart attack line enge thleng ti ang chi te kan react anga achan chu he video hi mizo mi puitena kan tangkai pui thei tur video ni in ka ria a tunlai a phei chuanin thi thut engmo le tiang vel kha atam em mai ani chuwang chuanin hrisel na lampang video te po hi ka siam na sa thina kan siam chole to don ani ama ero chu tuna chuanin kan siam dan style ero chu tianga video that deu omsa hi kan han react anga soizau ngai omani chuanin kan soizau bokanga heart attack lai hianin enge thleng ti chungchang hi kan react don ani tet et channel ania he channel hi katang kai pui thei khom nei ke pon.
Approximately 7 million people around the world die from heart attacks every year.
Kumtinin khovel pungpuya 7 million people hi heart attack avainan thiji ani 7 million hi keini hria thiam thei dan tur chuanin nuai som hi 1 million ania chuwang chuanin 7 million chu nuai som sari kumtina khovel pungpuya heart attack awanga mihring thiza chu nuai som sari ani nana pakhat awanga thiatan chuanin atam ve khop mai nuai som sari chumo.
And cardiovascular disease, which causes heart attacks and
cardiovascular disease awang hian hei na chi sang congenital heart disease kan ti te arrhythmia ti te coronary artery disease congestive heart failure high blood pressure le stroke heng zong he cardiovascular disease na nuai hianin an omle ni.
Other problems like strokes is the world's leading killer. So
cardiovascular disease from hi khovel pumpuya thina thlen tu langsar ber te zinga mi ani na zinga chon mo hi chu adik kepon research paper ka ziana le kalo review to na tang hianin kalo chiar ve thina ni article atang te po hian mo.
What causes a heart attack? Like all
heart attack hi engin nge thlen
muscles, the heart needs oxygen, and during a heart attack it can't get enough.
Heart kan lung heart a cell zong te hi kan taksa bung sang a cell ang tho ania chuwang chuanin oxygen amamo ani engtiklai po in heart attack a omlai hianin kan lunga cell te hianin oxygen anmamo khopkha le oxygen anmamo khoponi lo oxygen an mulo.
Fatty deposits or plaques develop on the walls of our coronary arteries.
Hi coronary artery nia hetiang artery hian hetiang thau hi ting hanin clotaron in siama chuwang chuan hetiang a vein in hong thalai te po kha khitiang thau khian in no ping the ani chu chuan in thisen flow thisen kalai hi ati boy train.
Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age.
Heng plek te hi kum kan upatil ti lemo le kan ele in kan uluk lo te kan lifestyle kan thada te hian heng hi aron cha chak thai ani chu chuanin thisen apo khanin oxygen pai thisen kha kan lunga hanin zuk supply ani chung oxygen pai thisen te chu kan lunga hanin zuk in supply lo chuanin kan lunga cell te khan oxygen anmamo kha an mudon lo ani
sometimes getting chunky, hardened or inflamed. Eventually the plaques can turn into blockages.
Hi poilutuk artery hi mo no top the ni.
If one of the plaques ruptures or cracks, a blood clot will form around it in minutes.
Kemi plaque khimo hemi fatty deposit thau hi tianga aloke palani chuanin kimi kan red blood cell kan thisen cell mang hianin blood clot kha aron in siam
and a partially closed artery can become completely blocked.
Kan artery kha in block top theni in block top chuan oxygen kal lai topa kan lungin oxygen na mutolo hei lunga cell te hian mo.
Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes.
Cardiac muscle kan ti chu cardiac te chu lung ti na khani top maya kan lunga muscle te hian kan lunga ti rol te hianin oxygen kha an mulo ani chuwang chuanin oxygen mulo chuan enge thleng mihringina oxygen kan hi blue thailo chuan enge thleng thina
This is a myocardial infarction.
Kha aming chu myocardial infarction ania chana ming dang le chu
or heart attack. Things can rapidly deteriorate in the absence of treatment.
Treatment kan don hlan lo chuanin kan din hmun kha a chen na sa thei ani ron chethut thei.
The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off.
Heart khanin kan lung khanin thisen kha apam chuak tha thei lo mai theya tin lung phut dan hianin ridima nei ve ni achanga phurang thut achanga phumuang thut kha ni lawa chuwan chuanin khatiang a phut dan pa ngai te po kha aron buai vek thei ani lung phurang lutuk le lung phumuang lutuk te po hi a hming om ve veka bradycardia te tachycardia te kan tia heng teng te po hi lung phut dan te po a normal lo chuan not normal ani kha chuanin a buai thlak thin to ni
In the worst case scenario, a heart attack can cause sudden death.
And heart attack hian thina a cheber a chuan ron thlen top thei ni.
And how do you know that someone is having a heart attack?
Heya poimo engtin nge mi hian heart attack anei ti hi an hriat theiang.
The most common symptom is chest pain.
Chest pain. Mase chest pain na zong hi heart attack ti na ni mi alo nia a chen de chumo anxiety kan nei na sat lutuk awangte kan ril ru a ha lutuk awangte le kan ril ru an nat lutuk awangte hianin helai om zone te hi ron to tup thrina kha heart attack ti na ni kher lo ani khalai kha chu kan hriat than ve kan hriat than thiam ve ngayo.
Caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw,
bana te veilam big ban veilam le khabe ate anakha tikhanin a hankal chho theini
back, or abdomen.
Nungle puma te po
But it's not always as sudden and dramatic as it is in the movies.
Movie kan huanga heart attack anei thuta athingal kan tiang kha chu animi alo.
Some people experience nausea or shortness of breath.
Mi then kha chu an luak te chuaka an thote ha phota.
Symptoms may be less prominent in women and the elderly.
Khami heart attack hian in symptom na dang ang thawin symptom aron lan chua dan kha anei ve veka chu chu mei chia le kumu ba te khanin a symptom kha anasalo big mai thei less prominent atin ka hriat ro tu na han.
For them, weakness and tiredness may be the main signal.
Mei chia le kumu pa lam te tan kha chuanin changoi ngoi zoi ngoi le khang te kha a symptom kha ani jok mai thei ani
And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent.
Avadin don ve khata kha chuanin diabetes nei ate kha chuanin heart attack awanga na lo om kha nerve diabetes in nerve khoi che to kha chuanin a hriat thei lo mai thei ani
If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them.
Min heart attack anei nia kan ril hel chuanin arang theiang ber chet kan lak wat fatanga ani Mizoram a chuanin a practical ber chu damdoina kan hal vat damdoina kan damdoin nai theiang ber le a enge service petha thei ber ha kal hal vat khani mai.
They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse.
Aspirin le nitroglycerin te khi chu damdoyan nia chu wan chuanin doctor cho lo e tur kha chu ani phot mai ni apoi mo bera chuan mani thua lo e verengot lo tur.
In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram.
Electrocardiogram hangin damtoina doctor te chuan heart attack ani nge ni lo te kha an lo diagnose zung thei don
to measure the heart's electrical activity, and a blood test to assess heart muscle damage.
Blood test heart muscle damage kan cardiac muscle kan lung ti rol chiat dan te po kha blood test ma khan nan lo zir theia chuanin electrocardiogram tro khami mang khanin kan heart electrical activity khan song te po kha an lo test theia ni khami mang khan heart attack kan nei nge nei lo ti te po kha an lo thei do na ni damdoina kal vat turo.
The patient is then taken to a high-tech cardiac suite where tests are done to locate the blockages.
Hei hi apoi mo khoya tak nge khoi arteria nge block om khami block om kha chuanin thisen kha flow thei don lo wa thisen a flow thei lo kha chuan kha apoya chuwan chuanin a blockage kha clear vat kha apoi mo ani.
Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty.
Angioplasty mangkhen kimi ki surgical procedure ania soizaw vak po ngai lo wa achan chu khalam kha chu knowledge nan shim chuan kimi angioplasty mangkhian heart attack khati angioplasty mangkhian in artery in block to kha in block to kha antigen yang unblock ngora I think ami so ava buai thak ka record rate to se bul ka record chi ni to box si lawa ai no ping to kha an vertical e thei ani de da me ngo ti khan.
Frequently, they also insert a metal or polymer stent that will hold the artery open.
Hi po hi apoy mo. Kila pa kit soivak lamente en liam pot meng ki chu in shit thiam tho ka ring.
More extensive blockages might require coronary artery bypass surgery.
Hitting surgery ti ki chu doctor ho perform tour. Mani ya lawin zai hona lawin ti velo tour.
Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage.
Ne hela hianin block om khachuan doctor te khan heta hianin blood flow kha kal tur khanin and redirect dei thayani ne hi mihring thiam na hi asang to mo chu wan cho apoi mo opera chonin heart attack to le pokana symptoms te pokha kan ron soilang ta heart attack nei ne kan in rin hel chuanin damdoin kalvat fat kha poi mo ber.
These procedures re-establish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk.
Genetic awangin heart attack te po hi ranom thaya chonin kan nundan kan uluk lo awangin kan lifestyle kan uluk lo awangin heart attack te po hi aronom thaya ni.
And the good news is that you can change your lifestyle.
Genetic khachu kan change thailo. Khachu genetic khachu ke mane na bedveni. Amai ro chu kan lifestyle kan nundan kan uluk phat chuanin heart attack hi engama chen kan prevent thei. Kan hemi la ka kan inveng thei.
Exercise, a healthy diet, and weight loss all lower the risk of heart attacks.
Exercise, healthy diet, weight loss. Ahar lo sin exerlak hi. Chuan eile in uluk. Thil mom deu han sew te chu poi lo wang. Amaro chu ni tina reng chu poi ve via wang nakina chuan mo. Chuanin thau lo tur. Cher tur ani top mai. Thau hi poi. Thau hi poi. Achan chu kan kumalo upatel tel hian abikin mei che te chu an ru te lo na wa hei an period ta nauten paya faten ringa khamia wang hanin an bone mass an lost to mai ni chu wang chuan tema kun kuma upat de nu chuanin hemikan khup ru te kong te khang ting te kha thau chuan nat na kan nei lo tur le kan thau lo wa kan thrisel that pa nga ya na mi lo na tur muna hanin kan thau chuanin na te po ha ronom ve theini in thithia mayem in fit lo te hi boi thlang ani chu wan chuanin kan nun kan lifestyle te hi ulukangai cold drinks hianin irin ain ati thawang che cold drinks hian achan chu sugar a pai nem lutuk.
Whether you've had one before or not, doctors recommend exercising a few times a week, doing both aerobic activity and strength training.
Hi apoimo office ni tinakal tetan page onin exercise asan pa de walak te hi angai atul achan chu risel na kan hun le tha te kan poisa te kan no invest kan lo sen ve de hian nakina na tam tak kan nei theitur lak akhani nastakin min venga tuna poisa kan lo seng hianin nakina poisa kan sen vak na tur kha enge khami tur lak ahanin min lo pui ve ni
A heart-healthy diet is low in sugar and saturated fat.
Sugar at lem na saturated fat lem na
Fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat.
Chicken and fish shisel khop mai choning green vegetables kizu country so izawa ka ngai lo king te ki etam zok tur a shisel zok
whole grains and nuts like walnuts and almonds.
Walnuts te almonds te whole grains
all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well.
Apoi mo khop mai tuna hianin 85 kgs kania pathian zara kadam chon ke po kumin kum to pa chonin 80 below ako va to do ni 85 kgs to ivarit ve min ti mai thaya ma se rit mi lo ni o thok khat lai khan 96 ka han hol heu me 100 te khop me ke ma po kha tuna chon 85 fa in maintain char Christmas don khan 85 kania Christmas le kum thar azawa 85 thau kalani ka in control ve ni o har ve khop me ele in hian min ti hlim se ke phei chumo.
And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example.
Kimidam doiki mani thuin lo lein lo ringot lo la doctor ron turo video hi chona ron soi langani ve mai
particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors like high blood pressure, cholesterol, and diabetes will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying
avoiding tobacco use zule muam ti la tur pai ma lot kan channel team nen pole in milzel
fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
eng lo ni hi video tanga ka zir so chomo mi pa ngai nun dana kan nuna thil pa ngai kan eya e muthun pa ngai kan muta tho hun pa ngai kan thoa thadewa kan nun kan mana exerte kan lak ve chuan heart attack te hi alo in avoid te hi enge heart attack la ka hianin na satakina invent hei mi pa ngai nun anga nun ve hani mai thil special tak polo om lo ni hi mi pa ngai nun anga kan nun du lo wa ngan e ngeka mezil te kan zu vaka khatiang ni kha chuan apoi thei le khati zong khatun tumata na kan react thei chu ni se heart attack chungchang kan han react khawan hi a in tang kai pui ka be sai ya resel na lampang video te pau kanon ti chok zeu to do da ni le ka soi to kan soi non lenge he ka channel te ka channel tom te min lo en sak thina ka lom khop maya en sak mai ni lo in mi then khat le mi tam jok chuanin in lo like ka in lo comment boka ka lom me mani a then te pe chuan in lo share kul vak le hala ka lom khop mai mi lo en sak zel ula mi lo subscribe sak zel ula nang ni pon munom titaka in lo en ti ka khiat hian ke po phurna min pe mo chuwan chuan video siam te poi anuam satani khati zong khatun truma video ta na ka siam thei chu ni a video le ka in mule theu don ni